Dr. Sylvi Martin. I'm so excited to have you here on the podcast.
Well, thank you for having me. It's always a pleasure to connect with you.
I was just saying before we hit record that I'm actually really looking forward to learning from you today. I think you bring such not just a wealth of knowledge, but such a well-rounded wealth of knowledge. I think the variety of experiences that you bring to the table are really quite fascinating. And I still remember the first time that you and I met in person back in the day when you could meet people in person at an event. And I remember just immediately really being taken by the variety of experiences that you bring. So I've done an intro, but I'd love for you to share with our listeners a little bit more in depth in terms of how you came to combine the really unique skills that you have.
Well, I guess it starts back. How far back do you go? But when I was really young, I always wanted to be a naturopathic doctor. And before going into that program, typically you need a degree to even get into the program. So I decided to complete a degree in nursing. And it was nursing that really helped to shift the trajectory a little bit because I fell in love with psychiatric mental health nursing. And when I graduated from Laurentian University, I ended up starting to work at St. Michael's Hospital in Toronto in acute care psychiatry. And I just was really taken with how important it was to find the meaning of treatment to somebody. It wasn't just about a label, a diagnosis, and a medication. It was about finding out what were they going through, how was that experience impacting their life, and what meaning did they get out of it. Because we always, I think as clinicians, you can relate that we always want this happy ending for our patients. And we always want them to, come down this road. This would be the best road for you. But it's really not about us making decisions in their life. It's about honoring where they're at in the decisions that they feel are right for their life. So I really liked bringing that perspective with me into naturopathic medicine. So I went on to complete a 4-year program full-time in naturopathic medicine at the Canadian College of Naturopathic Medicine. And I started practicing in private practice in 2009. So in the meantime, I kept nursing. So it was a bit of a very hectic time, those 4 years in my life, because I was literally working weekends, back-to-back 12-hour shifts in an acute care psychiatric unit. So it really gave a lot of perspective when I was learning, for example, about mental health care in naturopathic college and different treatment options. And then I was seeing such an acute exacerbation of what that looks like while I was in the hospital. So I started my private practice in 2009. And over the years, I was just always led to studying mindfulness-based techniques and how to incorporate that more into practice. And what I was realizing was, especially with the women that I worked with, is we lead such busy lifestyles in North America. And women just really needed that space. They could come to me, for example, with maybe a label of anxiety or depression from their family doctor. And when I had them in practice, I certainly am going to honor, a conventional psychiatric diagnosis. However, what I also learned is these women, they're just doing so much. There was so much on their plate. And they didn't know how to just stop and recognize their own needs. And I think a big part of my practice was learning to incorporate mindfulness-based techniques and also a lot of clinical nutrition, where we can certainly affect mood and affect how people feel by how they're eating. And as you know, when women are more stressed, when anxiety comes to the table, or when stress levels rise, or when people aren't feeling well because of depression or mood disorders, that self-care in terms of fueling themselves with optimal energy through their food might not be the first thing that they're doing. So it was always a balance to help women to balance out that nutrition and the lifestyle with how they're feeling. And that was something that shaped my practice early on. And what I started seeing were a lot of women who had would come to see me wanting to focus on weight loss, or they were concerned about their weight or gaining more weight around their abdomen as they approach perimenopause, for example. And I was noticing that women were coming to see me and they had issues with their relationship with food. And this was something, again, as a mental health nurse and as a naturopathic doctor, I always wanted to get to the bottom of the issue. And it wasn't about the calories they were eating or consuming.
Right.
Really, what it came down to is their relationship with food. What was triggering them to overeat, or why couldn't they stop eating at a certain point of the day? Why were they overindulging in certain foods? And I decided to, my first instinct as a nurse is dip into the literature, is what's going on, what happens when people are overeating. And it's not a true eating disorder, for example. Like, it's not like they have binge eating disorder or anorexia or bulimia, for example. But what's happening to these women who don't have eating disorders but still have disordered relationships with food? So I started digging into some of the literature, and there was a researcher that was starting to do quite a few pilot studies and becoming published quite a bit, Dr. Jean Christeller. And what I really liked about Dr. Christeller's approach is she comes in with, she's a PhD psychologist, and she did a lot of her training with Dr. John Kabat-Zinn in using a mindful-based approach to approaching relationship with food. So I ended up pursuing some clinical training with her in mindfulness-based eating awareness training. So we call it MB-EAT for short. And what I loved about that is bringing that back to my practice and helping women to apply that, is it wasn't necessarily that women didn't know how to feed themselves well. It's they'd either forget, or they were so stressed, or they had so much going on managing their careers and their families and different competing obligations that their relationship with food often wasn't something that they were nurturing. And so it was really a perspective of helping women to tune into that inner wisdom that they have, and recognizing the relationship with food and how certain factors could maybe lead to overeating, and not looking at it with an eye of blame, really applying a bit of curiosity to it. So I started using this in practice quite a bit. And then always wanting to dig a bit deeper, I came across intuitive eating. And this is a method that there is some traction being gained in scientific circles. When we look at intuitive eating, we know that women can learn to eat more intuitively. And what this means is really honoring their hunger and their fullness and their satisfaction, and really paying attention to the relationship with their body and the relationship with food. And
I am, it's interesting that you say that. So, because I'm seeing more and more and more attention, I think, being given to intuitive eating. And, I'd love to, I said to you before we hit record, I'm selfishly, here to just learn from you today and ask all the questions that I have. But can you help me and our listeners to understand, like, what is intuitive eating and how does it differ from mindful eating? I'd love to know, like, what are some of the practices? Like, how do you sort of distinguish someone that is using intuitive eating as an approach to really reprogram their relationship with food, which is kind of how I'm understanding it.
yeah, and they are a little bit different in the philosophy. Like mindful eating, if you look at MB-EAT as a whole process, it is a therapeutic process on its own. If you look at it with a narrow scope, people will look at it as just one factor. But when we look at intuitive eating, and this I think there's a lot of confusion being perpetuated on social media with intuitive eating and mindful eating, and mostly because I think there are a lot of social media leaders per se that are starting to promote intuitive and mindful eating, but they don't necessarily have clinical backgrounds, and they might not even have clinical training in the use of these therapeutic modalities. So I like to compare it to using like a cognitive behavioral therapy approach, where somebody who's not a trained clinician might not be able to apply that properly to somebody dealing with some mental health concerns, for example, or thought disorders. And it's the same thing that I'm seeing with intuitive eating, is these social media influencers starting to incorporate intuitive and mindful eating, and they'll take the principles and promote it, but they're still promoting it within a diet culture.
Yes.
And Intuitive eating is a whole process. It's a system that was developed by Evelyn Triboli and Elise Rake, and they're both master's trained dietitians, both based in California. And they actually have a process where they will train and use supervision with clinicians so they can learn to use intuitive eating properly with patients. And that's a process that I've gone and I've received or earned my counselor status in intuitive eating counseling. But it really is a process where we're helping people to honor hunger, fullness, satisfaction, but it's really engraved in a non-diet approach. So the whole purpose of intuitive eating is not for weight loss.
Yeah.
If anything, it applies more of a health at every size approach where every body, every person in every body and every body size can achieve health. And this doesn't mean that they need to shrink their body to achieve better health. So a really big part of where intuitive eating is different than mindful eating is mindful eating can sometimes be applied as a weight loss method.
Right. And that's my understanding, right? It doesn't always have to be applied that way. I think sometimes, we can use and prescribe mindful eating just to become more aware of how we're using food perhaps to soothe our emotions and perhaps be with our emotions instead, right? But and that's what I'm seeing, right? I am seeing that I don't know, a lot of times, but often I do see that mindful eating is being prescribed as another, almost like another diet, right? Where the end goal is still weight loss or the end goal is still to be a certain size.
Yeah, and I think the issue behind that is some of the research. So Dr. Jean Christeller, some of the research she's publishing is once she's accepted for a trial to be funded through the National Institute of Health, for example, they actually demand that they want to see a weight outcome. So even though that wasn't originally the intention of mindfulness-based eating awareness training, it is where some of the research funding ends up having parameters when it's funded, because larger institutions, they see this obesity epidemic as something they want to fight. But when we look at the roots of obesity and even the terminology we use and using the BMI, the body mass index, as a measurement scale, when you look at the history behind it, it's actually rooted in racism. And when we start to focus on weight and outcomes of encouraging people to shrink their bodies, I think it is a form of discrimination where we're saying somebody in one body size it doesn't have value unless they're smaller. We can shrink that body. And I really think that's a really slippery slope to get into when we're promoting anything to do with healthcare, because we're automatically excluding people who might be living in larger bodies that they might never get down to a size 8 or a 6 or whatever random number people are coming up with in magazines or as outcome measures, right? So I think it's really important that when people are using an intuitive eating perspective and a mindfulness-based eating perspective, that they are using it through the lens of health promotion and not weight loss, because as soon as we focus on weight loss, we exclude people and we change the goal. And when I can work with people who have struggled with weight for decades of their life and they've struggled with their relationship with food, and they come to see me and they have, I want to lose 80 pounds or 100 pounds, and I want to explore what's behind that. What's the motivation of the number? And is it, well, I want to be able to play with my grandchildren. I feel like I don't have energy. Wonderful. We can use these as goals. We want to increase your energy, get you more active, get you feeling better in your body, but we don't have to focus on a number on the scale to do that.
So it's a real shift in perspective, right? And I think one of the things I'm hearing, Sylvi, is that one of the foundations of intuitive eating is that the goal within that paradigm is never weight loss, right? Like that it's never attached to the number on the scale or a particular size, right? That's never the outcome that you're going after in the intuitive eating paradigm. Is that right?
Yeah. Yeah, and you're
Okay.
correct. And we can never guarantee somebody can shrink their body and lose weight. We have
Right.
no way to guarantee that. When we look at diets, and there's I took a really great course through Harvard, and it was on evidence-based optimal nutrition. And
Mm.
they don't actually consider a so-called diet. And when I say diet, I like to think of a certain pattern of eating, not a weight loss approach.
Mhm.
And they don't consider these patterns of eating to be successful until people maintain health outcomes 5 to 7 years post. And
Right.
that they can maintain them in the real world. So when we look at these diets where people are intended to be shrinking their body, oftentimes they're done in a lab, they're in a very controlled environment. People are taking something out of their diet, and they're, as a result, usually adding healthier things back in, right?
Mhm.
What do
Mhm.
we do if we
Mhm.
take out foods that maybe not the healthiest choices? We generally will tend to replace them with healthier choices, maybe more
Right.
fruits and vegetables coming in. So that can be health promoting on its own. But when we look at these diets that are intended to shrink a person's body, the long-term outcomes aren't there. And
Mm.
oftentimes people will, in the short term, like a prime example is the ketogenic diet, that
Mhm.
everyone seems to have hopped on the
Mhm.
keto diet over the last couple of years. And I'm not saying that the ketogenic diet can't be used therapeutically. I want to be very clear about that. I
Mhm.
think there is a place to use it therapeutically for individuals. However, just to have people jumping on the keto bandwagon to shrink their bodies, it doesn't necessarily mean they're going to be losing weight in a positive manner. Oftentimes,
Right.
people are losing water weight, they're losing muscle mass.
Right.
And longer term, is this something that is health promoting? Not
Mhm.
necessarily. And if
Mhm.
people can't stick to that ketogenic diet long term because it's not a sustainable lifestyle, then what's happening? They're getting this rebound weight that they gain.
That's right. And becomes such a vicious cycle, right? Which,
Mhm.
affects our self-esteem. Like there's so many pieces, I think, to what you just shared there. Could
Yeah.
you share with us? I'd love to know, as someone who admittedly knows very little about what intuitive eating actually is, could you share, like, what would be some of the protocols, or what would be some of the practices, maybe is a better term, right? What would be some of the practices that you would use as an intuitive eating counselor?
Yeah, so the first three I always like to start with are really four that are, there are 10 principles to intuitive eating, but typically the ones that I find myself going to first are checking in on whether or not people are honoring their hunger, or whether they're trying to achieve weight loss or follow diet culture. Because as
So
soon as we
can I
start to,
press pause there? Tell me
yeah.
what that means, because I hear that, right? Like, how do
Mhm.
we check in and honor our hunger? Like, what does that actually look like?
Yeah, so I like to encourage women to pay attention to their hunger as if they're looking at an odometer in the car, and or even the gas tank in the car is what I would look at. I would name that our hunger meter. And you think about it, is you wouldn't let your car get to an eighth of a tank of gas. You'd be already thinking ahead, where's the next gas station? I don't want to keep going another 50 kilometers without getting
Mhm.
gas.
Mhm.
And oftentimes, and I find women especially tend to kind of push through hunger, and they'll ignore that hunger during the day, and they start to actually lose touch with what their hunger level even is anymore. And when we don't pay attention to our hunger, and when we're not honoring that, it can be very easy. And a prime example is when you have working women around 4 o'clock, they're making a snack for the kids and they're eating everything in sight and they can't
Right.
stop.
Right.
And they might not have eaten enough for lunch. They might not have honored their hunger throughout the day. They might have skipped breakfast to make breakfast for the kids and then get on to their work meeting.
Mhm.
But oftentimes it's when we don't check in with hunger, it's very easy to overeat when we do get hungry. And when we get really hungry, such as being hangry and just wanting
Mhm.
to eat everything in sight, we start to lose that perspective on where our hunger is when we're eating, where our fullness is. We don't even pay attention. Are we even satisfied from the food we're eating when we're
Right.
ravenously hungry? So one of
Mhm.
the first things are paying attention to hunger. And a good example of this is I was working with a patient the other day, and she realized that I just eat and eat and eat and eat. And I know when I feel full and then I regret it, but she had no indication of where she was in terms of hungry in the
Right.
day. So I start to use a scale, and there are actually these activities you can do with women that you guide them. And typically, we'll bring in a snack. We never do this when somebody's really hungry. Like if you haven't eaten in 6 hours, this is not an activity we're going to do at that time.
Right.
But really just checking in with their body and helping them to tune into their body and recognize their hunger on a scale of 0 to 10, for example, of how
Hmm.
hungry are you? And asking them, well, how do you know? What
Yeah.
differentiates an 8 out of 10 from a 6 out of 10 from a
Hmm.
3 out of 10 not being hungry at all?
Hmm. Hmm.
And once they can start to gauge that, then we start to look at fullness. And because
Right.
hunger and
Hmm.
fullness are two different things, you can
Hmm.
feel full, but it might not address the hunger. So, for
Mm.
example, if I had you drink 1.5 liters of water, you would feel very full.
Right.
It wouldn't change your hunger rating
No.
because you're not getting any nutrients from the water.
Right.
So we start to pay attention next to that level of fullness through the stretch receptors in the stomach. And there are different activities such as using water as a tool to be able to gauge and rate fullness on its own. So
So interesting. Are there some really common, like for a woman listening today, right? And she's saying to herself, well, I'd like to kind of um, try some of this out. I'd like to practice some of this. Are there some like I know what I feel like when I'm hungry, right? Like, are there some common physical symptoms that we can begin to increase our awareness around? We can begin to really pay attention to, Sylvie, that you would say are sort of like some of those easier ones to really get in touch with?
yeah, I think some common ones, and this can be different for everybody. So I do want to highlight that. And sometimes when women have disordered eating, disordered relationships with food, where they might not be able to tune into that hunger and fullness so much. I don't want them to only focus on these sensations and think, well, if I don't feel this, I can't be hungry,
Mm,
because sometimes women can develop a different sense and might not be able to tune into that as much. So that's why generally it's always geared to the individual because it is different for every person. But generally speaking, people start to notice that they're hungry if their focus and concentration go down. They start to
yeah.
feel like a hollowness in their stomach. Maybe they start to feel like they're salivating already and digestion's begun without them. Shakiness can be a sign of low blood sugar. So generally, low blood sugar can be confusion, a bit of shakiness, just feeling like a little bit unstable from a mental focus perspective.
Mhm.
Those are signs that hunger's gone a little bit too far.
Yes,
um,
right. And you're training and you're teaching and coaching women to actually notice it before it gets to that stage, right? Whereas I think it kind of goes back to what you were saying, busy mom making something for her kids at 4 p.m. and eating everything in sight. It's like she's way beyond that.
yeah. And another thing is also helping women using therapeutic nutrition to plan for their day as well. So if
Mm,
if we have a woman and she's in back-to-back meetings all day, we need to make sure she's eating something in the morning that will keep her satiated, keep her fueled, not let her run out of steam. And oftentimes that will include foods that are higher in protein and higher in fats, as well as fiber, to make sure that those that energy from food is dispersed evenly throughout the day, so it helps them get to that next meal. Some women need snacks, some don't. And this is where I think diet culture is so scary because women are bombarded with nutritional information almost everywhere they go, whether
yes.
it's their coworkers, their girlfriends, their family members, somebody commenting on your food as you're putting it on your plate. Like, get off my plate, people. Right? Like,
Yes.
at the end of the day, that's actually from a coworker of mine. Had a patient say that to family member, just get
Uh-huh.
off my plate. And
Right.
I love that. I love that saying. And so when, we're teaching women, oh, eat snacks every 2 to 3 hours, some women might not need snacks every 2 to 3 hours.
Right.
So we don't
Right.
want to be applying food rules.
And
And
there are
that's,
so many, right? There are
mm,
so, like that's such a good way to put it, Sylvie. It's I feel like everywhere we turn, there are all these rules, and all the rules actually conflict with one another, right? Like
exactly. It's like you hop on a social media and you'll see opposite things. I've seen anything from so-called social media influencers well, this isn't a diet, but just don't eat any fruit because they're high in sugar. Like,
Right.
who was telling people not to eat fruit? Like, you
Oh
really
yeah.
have to look at,
Yeah.
to even have any clinical training, because there's so much
Right.
evidence to
Yes.
the health benefits you get from eating fruits and vegetables. So I just think, it becomes a really slippery slope when women are being fed this health information from magazines, newspapers, their colleagues, their friends, and they've lost that ability to trust their own body.
Mm.
And I think this is just something that intuitive eating helps them to tune into themselves again. So
Yeah.
there's not one recipe that works for everybody. There are principles to intuitive eating, but it really comes down to making it so the individual learns what works best for them and can honor
Right.
their hunger, honor their fullness, get full satisfaction out of foods. That's another big
Yeah.
factor, is finding out, what do you even like? And when you start to pay
Yes.
attention to foods, people might realize, well, I actually don't like the taste of cake. I like this type of food. This I don't
Yeah.
enjoy as much. And you start to really hone your focus on what you really want, what taste
Yes.
satisfaction you're after.
Well, it's interesting, right? Because if I think about it from a psychological perspective, if you're no longer viewing food as good and bad, right? If you're no longer looking at food as which ones can I have and which ones should I restrict, and you actually have the option of having all foods, and you actually ask yourself what you'd really like to have or really enjoy, I think our choices become very different, right? Because we're no longer making choices around, well, this is restrictive, but if this is my cheat day, or if I'm just so stressed, I'm going to binge, then I'm going to go for things that I've restricted, but I may not even enjoy those foods,
Yeah. And
right?
we know with, even with eating science, we know that as soon as somebody starts to restrict, it actually perpetuates a binging restricting cycle.
Yes.
So we restrict, then what happens? We inevitably will eat that thing. So say I said, oh, chocolate's bad. I have no control over chocolate. If that was my perception, as soon as I had a piece of chocolate, I'd feel like I failed. Now I
Mhm.
have this guilt and shame. What does that do? It perpetuates this eating cycle that I
Mhm.
feel like I have to control it and never have it again. I just can't have it in the house. And then all of a sudden it just keeps that cycle going when people end up having it when they're out one day and then they feel like a failure.
Yeah.
And what we aim to do with mindful eating and with intuitive eating is breaking that cycle. We want to address that guilt and shame. There should not
Mm.
ever be guilt and shame on a meal. In a meal,
Right.
it's not
Right.
ingredient. It doesn't deserve to be on the plate.
Mhm.
And I did this recently with a patient of mine who was diabetic and pre-diabetic actually, and we were actually monitoring blood glucose levels as well. So this is the beautiful thing about this is we were able to actually look at foods that she knew would spike her blood sugar for a couple of days after,
Mm.
and she really liked cake. And the first thing I said, and she thought she had no control around cake, didn't want to be eating it. And I said, we need to bring cake in. And for most people, this is counterintuitive for a lot of clinicians who focus in nutrition.
Mhm.
But if I know that when she does have cake, she has 3 or 4 slices and can't control it, that's not
Yeah.
helping anybody longer term. So the first
Right.
thing I want to do is give her permission to eat cake and
Right.
permission to eat as much as she wants.
Yes.
But when we start to focus on hunger, fullness, satisfaction, she learns to actually set the environment to enjoy that cake, not eating
Mm.
it in front of the TV where she's
Right.
distracted.
Right.
She started to realize, I'm perfectly satisfied with a third to a half of a piece of cake and I enjoy it. And I know
Right.
it's there if I want it. And it was actually better for her blood sugar control longer term to have a little bit of cake. And in the
Mhm.
meantime, we were still working on other nutritional factors therapeutically to improve glycemic control, her blood
Right.
sugar control.
Right. Right.
So
It's the overall picture, right?
yeah. And it's really one thing I love about it is it really marries the best of clinical nutrition where it meets the background that I have with mental health nursing. Like
Yes. Mhm.
as soon as you think about the complexity of someone's relationship with their own thoughts and behaviors, and then you add in a layer to the relationship with food,
Yeah.
and arguably our relationship with food goes back as long as our longest relationship with humans. Like with our
Yes.
mother, that relationship with food and feeding and behavior, it's a lifelong relationship. It
It's
changes over
so
time.
integral. It's so
Mhm.
integral, and one of the things, I no longer practice one-to-one anymore, but when I was practicing and I would see women who struggled with disordered eating, one of the things that we would often talk about is this idea that a relationship with food is it's not a relationship we can end. Like we
Mhm.
could have a toxic relationship with a person and we can
Exactly.
choose to end that relationship, right? We can choose to not put ourselves in an environment where we're going to be exposed to that trigger, whatever it is, right? But our relationship with food is a relationship that we have, and our relationship with our bodies,
Mhm.
right? Which I think our relationship with food often ties back to our relationship with our bodies, is something that we carry with us for the rest of our lives. It'll never leave us. Food is an
Yeah.
integral part of who we are. It's even a part of how we socialize. I mean, right? Like it's celebratory. It's food is a huge part of our lives.
Yeah, it's a bit of everything. It's survival for some
Yes.
people. Like if you
Yes.
grew up in a house where food scarcity was a thing, and this is a big thing for a lot of Canadians and a lot of Americans and worldwide,
Mm-hmm.
your relationship with food is going to be a bit skewed. You're going to want to
Yeah.
eat and hoard and collect as much as you want. You might not view it as something that you have time to eat, right?
Yes.
Because if you grew up and there was never food in the house, as soon as food comes into the house, everybody's after it, right?
Yep. That's right.
So there are different primal drivers of our eating behavior, similar to our fear response as humans, is how we look at things from a mental health perspective and how we react to certain things or how anger can come up. These things can happen with food. So we even know from research that people who experience pretty extreme emotions and have difficulty regulating their emotions also have difficulty regulating their food intake.
Right.
So, for example, if you don't know how to manage your anger or you don't know how to manage your sadness, you're going to food, and not just food as comfort. Food is comforting, and I
Mm-hmm.
think there is a role for that.
Mm-hmm.
But it's, how does someone feel if they're angry and all of a sudden, like, I ate so much, I feel full, I feel disgusted with myself, I feel guilt and shame now, and it
Right.
perpetuates that cycle. So it's really, when I'm working with individuals, it's learning, where are they at, how is their relationship with food. I actually use clinical intuitive eating assessment scales that have been validated in different studies to assess what we need to prioritize when I'm working with them. Because you can't just start principle 1 with everybody. Some
That's right.
people might need principle 8 first, right?
Yes. Yes. So it's a very individualized, very holistic approach. And it really is looking at that bigger picture, right? It's not just looking at that slice of cake, but it's how does that slice of cake actually, where does it fit within your psyche and your relationship with yourself and relationship with food, relationship with your body, and then that whole sort of schema around nutrition.
Mm-hmm. Mm-hmm.
I love this, Sylvie. This is so, so interesting. And, I'll definitely have to have you come back on here because I think that I've certainly noticed an increase, like I said, in terms of information. I don't know. And I find that often it can be very, very confusing. I see posts all the time on social media with somebody eating a donut saying, I'm eating intuitively. And I think the image or the impression that I'm getting as someone who doesn't know very much about it is that, well, what is it? Like, right? Is it just about like eating all the foods that maybe you never used to eat before? And there's got to be a bigger sort of picture to what this is really all about. And I really, really appreciate that. If there was one small change that we could all make, because I think what you're describing is something that is inclusive,
Mm-hmm.
meaning that I can't imagine anyone needing to exclude themselves from some of the benefits of intuitive eating, right? We may not choose to work with an intuitive eating counselor, but I think that there are some benefits that we can all stand to gain from adopting some of these sorts of principles because they're so countercultural, right? They're
Mm-hmm.
so, the exact opposite of what diet culture tells us. So, if there was a small skill that we could all begin to practice that would just allow us to, I guess, when I think about it, it's almost like make peace with our relationship with food, make peace with our relationship with our body. What could that be? What's a small change that we can begin to practice?
Yeah. And what you just mentioned, actually, that's one of the principles of intuitive eating, is making peace with food.
Mm.
I think one of the first things is really, when people are sitting down to eat, take just 2 breaths. To first breath, just noticing your breath. Second breath, just noticing your hunger level. and taking the time to look at the food you're about to consume,
Mm,
appreciate the food where it might have come from. I certainly know I appreciate my blueberries when I'm eating them in the wintertime because,
yeah.
you know, they ended up still, they're being brought in, they're being transported in if I'm not eating them frozen. And just recognizing that and starting to engage all of our senses when we're eating. So looking at the texture, noticing the smell when we're bringing the food up to our mouth,
Mhm.
noticing the flavor, the taste, the texture when we're chewing it. And taking that time, I usually encourage people halfway through a meal is just, again, another 2 breaths. And you can do this while you're with other people,
Yeah.
right? You
Yeah.
don't have to be like, excuse me, I need to meditate on my food right now. Which by all means, if that's your thing, go for it. But just doing that little check-in, I like to think of it as like a little speed bump or kind of a little moat in the food where we just stop and
Mm,
re-engage with our senses. How am I feeling about this food? Do I want to continue to eat it? Am I feeling full? Am I starting to feel less hungry? Am I still enjoying the meal? And making decisions from there. And I think something else is really that is really important, I think is almost foundational before I even dig into these skills with individuals that I work with. It's looking at the food that they're eating during the day and really making sure they're consuming enough to meet their needs.
mm,
If they're getting hungry between meals, chances are they might not be eating enough at mealtime.
right.
And I find with women especially, they'll think, well, I just had a salad with a bit of chicken and lettuce and a couple of veggies. And I think, well, where are the healthy fats in that? Where are our complex carbohydrates?
Right.
And it might not actually get them to dinner time. And that's something that sometimes it needs some skill where they might need to work with a clinician, but sometimes it's just a matter of looking at it and making sure they're not under fueling. So if they're finding by dinner time they could eat 2 full meals, chances are we need to disperse that food a bit more evenly throughout the day.
Yes. Oh, so helpful, so practical. It's actually at the time that we're recording, it's lunchtime for me. So I'm as soon as we're done, I'm gonna practice exactly what you said is just really being more present because I have a very bad habit of heating up my lunch and I'm like, I'll just get through a couple of emails
Mhm.
while I eat, right? But I am gonna take your advice, my friend. I am gonna sit with my lunch, which I'm really looking forward to, and practice some of that. So thank you so much. Dr. Sylvie, where can people go and find you?
They can find me at Dr. Sylvi Martin, Sylvi Martin.com or nourishingwellbeing.ca. That will bring them to my website as well.
Amazing. Thank you so much for sharing your wisdom with us today.
Thank you for having me. It's always a pleasure.